No single food fights inflammation, but the overall pattern of what you eat truly can, and that is actually good news. It means you do not have to hunt for one magic ingredient or feel guilty about one imperfect meal. In the next few minutes, I want to give you the practical picture of what an anti-inflammatory way of eating looks like for a cancer survivor, why it matters, and how to start without overhauling your whole life this week. First, a quick word on why we even talk about inflammation after cancer. Your body uses inflammation to heal, and short bursts of it are normal and necessary. The concern is chronic, low-grade inflammation, the kind that simmers quietly in the background for months or years. That state can create conditions in the body that are friendlier to cancer cells than we would like, which is why survivorship guidelines keep pointing us toward eating patterns that calm it down. And I want to be clear from the start. Food is one lever among several. Regular movement, decent sleep, and keeping your weight in a healthy range for you all pull in the same direction. Diet is a powerful piece, but it is a piece. So what does the pattern actually look like on your plate? Start with vegetables, because they do the most work here. A simple target is to fill about half your plate with non-starchy vegetables at meals, aiming for at least 5 servings a day. Variety and color matter, and the cruciferous family, things like broccoli, cauliflower, and Brussels sprouts, deserves a regular spot in your rotation. Next, look at your carbohydrates. This is not about cutting carbs. It is about choosing whole grains like oats, brown rice, and quinoa more often than refined ones, because whole grains are gentler on your blood sugar and insulin response, and that matters for inflammation too. Then there are the fats, and this is where the Mediterranean flavor of this pattern really shows up. Fatty fish like salmon, sardines, and mackerel 2 to 3 times a week gives you the omega-3 fats that your body uses to help resolve inflammation. Extra virgin olive oil becomes your everyday fat, a couple of tablespoons a day for cooking and dressing. Nuts fit here as well, and they have a special footnote for survivors. One study of people after a colorectal cancer diagnosis found that regular nut eaters had about a 57% lower risk of recurrence. That is an association, not proof that nuts cause the benefit, but it fits the bigger picture beautifully. Add legumes, meaning beans, lentils, and chickpeas, 3 to 4 times a week. Their fiber feeds your gut bacteria, which produce compounds like butyrate that help keep inflammation in check from the inside. And if you enjoy cooking with turmeric, black pepper, and ginger, use them freely. They are studied for their calming effects on inflammatory pathways, and at the very least, they make healthy food taste like something you want to eat again tomorrow. On the other side of the ledger, 3 things do most of the harm. Processed meats and, to a lesser degree, red meat are worth cutting back, since processed meat in particular is classified as a carcinogen. Refined carbohydrates and added sugars keep insulin and inflammation nudged upward, so let them be occasional rather than daily. And alcohol is honestly the hardest conversation, because it is also classified as a Group 1 carcinogen. Less is better, and for many survivors, the most protective choice is little to none. You get to decide what feels realistic, but you deserve to know the evidence plainly. Now for the reassurance, because it matters as much as the food list. This pattern is not a cure, and no honest clinician will tell you it is. Some trials of dietary changes in survivors have shown mixed results, and the strength of the evidence varies by cancer type. What this way of eating offers is a sensible, evidence-aligned foundation, the same pattern major cancer organizations point to, done imperfectly and consistently over time. You do not have to be perfect. Aim for most meals, most days. And please loop in your own care team, especially your oncologist and a registered dietitian, because your history, your treatment, and your body are specific to you. Start with one change this week. Maybe it is olive oil on the counter or beans in Tuesday's dinner. Small, steady, and kind to yourself. That is how survivors actually eat this way for years, and years are exactly the point.